Hi everyone, my name is Kylie Baldwin and thank you for joining me today. I am here to present a public health initiative designed to improve child immunization rates right here in Jackson, Michigan. This issue affects not only the health of our kids, but also the strength and resilience of our entire community. Let's start with what the data is telling us. In Jackson County, only 61.2% of children between 19 and 35 months are fully vaccinated, compared to the state average of 67.5%. Even though adolescent immunization looks stronger overall, HPV vaccine coverage is much lower, just 47.9%. We also can't ignore how cultural beliefs and political attitudes influence vaccine hesitancy in some areas. Combined with disruptions caused by COVID-19 pandemic, these factors have led to a decline in timely childhood vaccinations. Some root causes for this in Jackson County are some socioeconomic barriers. Jackson County has a higher poverty rate, making it difficult for many families to access healthcare services, including vaccinations. This isn't just a numbers problem, it's a health emergency in the making. Low vaccination rates increase the risk of outbreaks of preventable diseases like measles and whooping cough. These diseases can be especially dangerous for infants and young children. If we don't act now, we risk overwhelming schools, hospitals, and families. It's far more cost-effective to prevent illness through immunization than it is to manage an outbreak. That's why urgent action is necessary. Some efforts and solutions for this are that the Jackson County Health Department provides vaccines through walk-in clinics, although Jackson could benefit from more mobile clinics, which is what we'll talk about further on. Public health strategies focus on community education, outreach, and rebuilding trust in vaccines here in Jackson County. Several root causes contribute to this issue. First, economic barriers. Jackson County's poverty rate is higher than the state average, which limits access to health care. Second, transportation. Many families lack reliable ways to get to clinics. We also need to acknowledge historical distrust in the medical system, especially among marginalized communities. Jackson County has relatively few pediatric care providers to meet local needs, adding another layer of difficulty. When vaccination rates fall, the whole community feels the impact. Herd immunity weakens, and children from low-income families are especially vulnerable. Back in 2019, Michigan had a measles outbreak directly tied to under-vaccinated areas. That could happen again here if we don't act. Every missed vaccination today increases the risk of preventable illness tomorrow. The longer immunization rates decline, the harder it is to recover from missed vaccinations. As of 2023, 22.2 million children missed their first dose routine of the measles vaccination. Public health efforts must address transportation, education, and access barriers now to prevent future outbreaks. One solution is to bring vaccines directly to families, such as mobile clinics. They have been successful in cities like Detroit and Chicago, increasing vaccinations by 25% in underserved neighborhoods. In Jackson County, these clinics could visit schools, churches, and grocery store parking lots to eliminate transportation barriers. This approach is efficient, low cost, and proven to work. Another strategy is offering small but meaningful incentives. States like West Virginia saw a 15% increase in vaccination rates after offering gift cards. In Jackson County, we could offer gas cards, grocery discounts, or even school-based rewards. But incentives work best when paired with community education, so families not only feel motivated but also confident in their decision to vaccinate. Politics also play a role. Nationally, vaccine hesitancy tends to be higher in conservative areas, and that's reflected here in Jackson County. To move forward, we need to build bridges. That means partnering with bipartisan community leaders, pastors, school principals, people the public already trust. If we lead with empathy and facts, we can break through the noise. Jackson County is a tight-knit community with strong local ties, but transportation issues, limited resources, and cultural skepticism towards vaccines have created unique challenges. Any solution must be rooted in trust and accessibility. Past efforts lacked flexibility and failed to address mistrust and logistical barriers. We need to go beyond just offering services. We must bring them into communities in ways that feel safe and convenient. Our plan is called Vaccinate Jackson. In phase 1, we focus on planning and outreach. Phase 2 launches the full initiative, mobile clinics, educational materials, and incentives, all based on community feedback. To make this initiative work, we're deeply involving the community, from school staff and churches to parent groups and student leaders. We also have a powerful advocate in Kristen Pluta, the health officer of Jackson County. She brings leadership and credibility, helping us speak at community events, support school-based clinics, and reach the public through media to combat misinformation and to build trust. This initiative requires time, funding, and leadership, but it is an investment in our kids' future. We'll track our success by monitoring immunization rates, event turnout, and how community attitude changes over time. For time, focusing on weekly planning and clinic coordination, money, focusing on receiving grants, donations, and health funding. For success metrics, focusing on vaccination rates between the ages of 19 and 35 months and teenagers, tracking the attendance at events and mobile clinics, and even perception shifts from community surveys. Listed here are all of the relevant sources used for any of the information provided in these slides. Thank you so much for taking the time to listen and learn today. Protecting our kids is a shared responsibility, and together we can create a healthier Jackson County for future generations. If you want to get involved, volunteer, or help spread the word,